हम सब में बांटने वाले हैं। उनके लेक्चर से हमारा ये आज का दिन रोशन होने वाला है। सो तैयार हो जाइए आप सब।
मिस होमो, आजकल मेंटल हेल्थ इश्यू बहुत बढ़ गए हैं। डिप्रेशन, बाइपोलर डिसऑर्डर, ये सब बहुत सारे बढ़ गए हैं। क्या हम ये सुजोग से ठीक कर सकते हैं?
हाँ हेट्रो, बिल्कुल कर सकते हैं। इसमें सिर्फ हमारी एनर्जीज थोड़ी ब्लॉक हो जाती हैं, इसीलिए तो ये सारी परेशानियाँ आती हैं। तो हम अपनी एनर्जीज को बैलेंस करके, स्ट्रेस को रिड्यूस करके और मेंटल क्लैरिटी ला सकते हैं।
ओ वाओ, मुझे तो और भी जानना है सुजोग को साइकोलॉजिकल प्रैक्टिस में कैसे यूज़ करते हैं।
हाँ, तो हम सबको ये जानना है, तो साइकोलॉजी से रिलेटेड डायग्नोसिस एंड ट्रीटमेंट प्रोटोकॉल बताने आ रहे हैं एसजेटी डॉक्टर प्रभु फ्रॉम बेंगलोर। गिव अ बिग राउंड ऑफ अप्लॉज फॉर एसजेटी डॉक्टर प्रभु।
कहाँ है डॉक्टर?
And then somebody will say over information. Wonderful. I have a question for you. Can anybody sitting here explain to me, can you give me a substantive reason for the multiplicity of the correspondence systems? Basic. Can anybody give me a reason for the multiplicity of the various correspondence systems available in Sujok therapy? I can't hear you. Learn from me. Anybody else apart from her? What is the reason for the multiplicity of the varied correspondence systems available in the human hand, the human feet, all over the body? Why? Why did Professor Park give us 1,000,000 correspondence system? Has anybody ever asked the question? Everybody says, he said, he said, he said. Fair enough, he said, but why did he say that? Did you ask the basic question? No. Good. You don't ask questions, you don't get the answers. So you want to know, ask the right questions. Please. Okay, आप हिंदी में भी थोड़ा हिंदी और थोड़ा इंग्लिश. Okay. The second part. हर कोई बोलता है Sujok is magical, Sujok is wonderful, Sujok is amazing. Absolutely true. But you know, these are words used by a kid. एक बच्चा बोलता है. Amazing, wonderful, magical, so on and so forth. The reason why people use the word magical is because you don't understand magic. You're not supposed to understand magic. Shoom, a pigeon comes out. The magician understands that. So for him, it's not magic, it's science. There's a technique. It's replicable. Anybody can become PC Sarkar. It's not magic, it's science. So if you're still sitting here 10 years after he is no more, no matter where he is, and you still continue to say it's magic, then you're still kids. You can interpret that in multiple ways. I leave it to you. It's not magic, it's science. विज्ञान है. और विज्ञान जानने के लिए समझने की आवश्यकता है, और समझने के लिए पढ़ाई करने की ज़रूरत है, और पढ़ाई करने के लिए मेहनत करना पड़ता है. And life is a choice. You can choose between watching a movie on Netflix or picking up your book and reading and studying. Zindagi, I mean, it's up to you. You decide how you want to spend your time. Okay? What is hysteria? These were the couple of questions I wanted to ask. Like I asked you the last time, do you want to remember Professor as a saint or a scientist? I still ask you the question. If you want him to be a saint, then he'll be unquestionable. आप उसका सवाल नहीं कर पाएंगे. Whatever he has said, it is dictum. पत्थर की लकीर या कोई भी चीज़ हो जिसे आप बदल नहीं सकते, वो लकीर पर उन्होंने बता दिया, तो उसका आप उल्लंघन नहीं कर सकते, तो वो सेंट बन जाता है, साधु महात्मा बन जाता है. भगवद गीता में कोई चेंज नहीं आ सकता, ना एक कॉमा ना एक फुल स्टॉप. कुरान शरीफ में नहीं आ सकता है, गुरु नानक जी के ग्रंथ में नहीं आ सकता, लेकिन विज्ञान के हर किताब में चेंज आ सकता है. हिपोक्रेटस ने जो लिखा था आज उसे फॉलो नहीं करते, गैलन ने जो लिखा था उसे हम आज फॉलो नहीं करते. शायद इसीलिए हम आज जिंदा हैं, क्योंकि रैबीज का वैक्सीन आ गया, कोविड का वैक्सीन आ गया। तो आप डिसाइड कीजिए कि आपको संत चाहिए या साइंटिस्ट चाहिए। Science is available for scrutiny. Saints are not available for scrutiny. Saints are to be worshipped. Choice आपके ऊपर है. I have made mine. Okay? After that, where I elevate him to is up to me. But if you want him to be accessible as a saint, then what you're doing is propagation of a cultist idea, not scientific idea. Okay? Okay. I have my 15 minutes. It's 1:40 and I want to stop in 15 minutes this time despite giving you the over information. Have you heard of this term called hysteria? एक मार्कर मिलेगा नारावनी जी, सॉरी एक स्लाइड चेंजर मिलेगा, है पॉइंटर? ये सवाल है सुजाक में मल्टीप्लिसिटी क्यों है? जवाब ढूंढिए, मिल जाएगा। ये कोई भी कर सकता है। यहाँ पर ओके, मैजिक, हाँ, ओके। हैव यू हर्ड ऑफ दिस टर्म हिस्टीरिया? हिस्टेरिकल, उसका आप अर्थ जानते हैं कि हिस्टीरिया क्या है, हिस्टेरिकल क्या है, किसने वो शब्द का इस्तेमाल किया? Who used the word hysteria for the first time? Any idea? You should look Google. All you do is watch YouTube shorts. Hysteria was the word first used by a person called Sigmund Freud from Vienna, who discovered psychoanalysis. Do you know what it meant? Psychoanalysis is even today a very strong branch in psychiatry. And my topic today is an outline of psychiatry, psychology, and psychotherapy. Okay? Psychiatry is very distinct because psychiatrists prescribe medication. Okay? Psychologists are not authorized to prescribe medication, and psychotherapists are not authorized to prescribe medicines also. Psychology is a broad spectrum. Psychotherapy is dependent on schools. We will cover that also. I will not be able to finish this presentation completely, so I will still stop in 15 minutes, and if I do injustice to you, you can hang me for that. I'm ready. I'm already hanged a million times. Okay. Okay. Next, please. Either I don't know how to use it or, yeah. So we'll look at all these things, and each of them is it's an in-depth subject on its own. The historical origins of psychiatry. Do you know how mental health started? Before that, the word hysteria was founded by Sigmund Freud. Sigmund Freud is the founder of a school called psychoanalysis, and he would talk to people. He was the one who used Anton Mesmer's hypnotism to cure mental illness. Way back at that period in time, the wealthy aristocratic women who did not have any standing in society, they had a lot of time, but they were practically, used less. I wouldn't say useless. They were used very less. They were women have always been used for decorative purposes. They used to dress up very nicely. They used to be hosts to parties and so on and so forth. And, their husbands used to make merry around. They used to visit the harems, the brothels. They used to go hunting. They used to discuss politics. They used to get into war. And the women were left unsatisfied. And they found in Freud a ear that they could go to and they could talk. And he found out that all these women, he hardly saw more than about 25 clients in his whole life. And out of that, he built a whole science called psychoanalysis. इतने कम पेशेंट देखने के बाद उन्होंने एक साइंस बिल्डअप किया. So he saw in all the women that he interviewed that they were sexually repressed, and that's when he said a sexual conflict led to this condition called hysteria. Hystero means what? Hysterectomy means what? What does hysterectomy mean? It's a medical word. Exactly. Okay? Removal of what? Yes. So what is the purpose of the uterus? Either procreation or recreation, right? So he said there's a conflict there, and that's the reason why these people are acting deranged like this. So you can understand where mental health goes back to. Okay? So this is my topic. Won't be able to cover it. The historical origins of psychiatry. What happened? Initially, people were, when do people really visit a psychiatrist? Have you ever been to a psychiatrist? Because going to a psychiatrist even today is a taboo. कोई नहीं जाना चाहता है, पागल हूँ क्या? This is what they say. लेकिन पागलपन हर किसी में है. वो पागलपन किस तरीके से चैनल होता है वो उसे देखना ज़रूरी है. एक जुनून रहता है वो भी एक पागलपन है. एक फिक्सेटेड आइडिया रहता है वो भी एक पागलपन है. उसे छोड़ने उसके अलावा और कुछ दिखता नहीं है उसको. Arjuna was a pagal because he only could see the pupil in the eye of the bird. Was he not a pagal? Hey, तुमको ये खड़ा है वो खड़ा है. I said nothing doing. This is what I see. Fixated. Today, fixation is technical. I mean, it's a prime symptom in autistic disorder. He's very fixated. He cannot see anything beyond this. So was he autistic? So all of us have everything in us. Only thing is we are socially acceptable. हमें समाज स्वीकार करता है. जिस दिन समाज स्वीकार नहीं करेगा, तभी भी हम लोग मेंटल हेल्थ प्रोफेशनल के पास नहीं जाते हैं. हम कब जाते हैं? हमारे बीवी बच्चे स्वीकार नहीं करते हैं, ठीक है, लेकिन वो टॉलरेट, वो सहन करते हैं. हमारे दोस्त, our friends, our very near and dear, our relatives, people who are very, very close to us, okay, they tolerate us to a very large extent. But when it goes beyond their toleration, that's when they say, look, he's irritable. Take him to, get him help. Lock him up in an asylum. Lock him up in an asylum. Sorry, उसको बंद कर दो. Next, उसको बंद कर दो. तो these are pictures. तो पुराने ज़माने में लोगों को तालाबार आज भी इस देश में करते हैं. भूत प्रेत का साया है, क्योंकि पता नहीं है. कम से कम पेट में दर्द है तो चीर फाड़ करके पता कर सकते हैं कि लिवर है, गॉल ब्लैडर है, हार्ट है, किडनी है, क्या है. कम से कम दिख तो जाएगा. हमने तो अगर कोई देखना चाहता है. तो पहला ही बोल दिया. लेकिन अगर कोई बोल रहा है मैं हवा में उड़ रहा हूँ, तो क्या देखेंगे आप? हवा देखेंगे या पंख देखेंगे? तो भूत प्रेत का साया आ गया. तो from demons, from possession, and so on and so forth. If you look at history, Joan of Arc was persecuted because she was supposed to have been possessed by the demons. Yeah, she was burnt at the stakes. क्या था? एक जुनून था कि फ्रांस को, I don't know which country, France, Joan of Arc, तो उसको liberate किया जाए. जुनून, a fixated idea. The history of psychiatry, like any other science, is very, very varied. Okay, starting from being chained to being whipped to being starved to being thrown into cold water to being thrown off the cliff to being burnt at the stake, ये सब हुआ है mental health में. क्यों? ये लोग हमें acceptable नहीं थे. और ऐसे ऐसे terminology आ गए जिसको हम बोलते हैं schizophrenic. What is schizophrenia? आपने कभी सोचा है? Skids, split. Where is the split? Bipolar, maniac, depressive disease. वहाँ से लेके पहले क्या करते थे? पहले बोलते थे भगवान की प्रार्थना करो. Satan है, शैतान है. झाड़ फूक करो. They would take a leaf and bang him. शुद्धिकरण करो. That was being done. Then they said, take this dhatura seed, ganja, weeds. At least it will cool him. It will make him calm. He used to jump up and down. He used to be very aggressive. Dhatura seeds दे दो. Give him weed. He'll cool down. उसको synthesize किया, वहाँ से cocaine आ गया, वहाँ से heroin आ गया. गलत इस्तेमाल हुआ, that's a different issue. लेकिन useful था इसीलिए आ गया. बिना use का कोई नहीं है. Okay? Right? So that's how it grew because they found a use for that. इसको एक कोक मार दो, चुपचाप बैठा रहेगा. He'll keep quiet on his own. कम से कम अपना काम तो चल जाएगा. I can be more productive rather than listening to him, telling keep quiet, keep quiet, keep quiet. They would chain him. They would put him in a small box like this, Or the aristocratic people, they would say he's very, very stressed out. Next slide, please. They would say, this is how it used to be. I'm seeing visions, visual hallucination. मुझे ऐसा लगता है कि मेरे सामने भगवान श्री कृष्ण खड़े हैं. सही है, गलत है? I don't know. You decide. Okay? और साक्षात ये खड़े हैं, तो उसको बंद करने के लिए ऐसा था. Okay? Then they would put him into all sorts of inhumane things. They would induce such things so as to introduce more pain so that he could forget the acts that were causing pain to somebody else. Are you understanding this? Suppose I'm going to hit him. Okay? For me to stop me from hitting him, I need to undergo a bigger pain so that this pain becomes more important and I do not hit him. So ऐसे भी कार्यक्रम चलते थे mental health में. Next slide, please. And this used to be a mental asylum where the rich and the aristocratic people. Smoking is bad. For you, not for me. Okay, am I back? Okay, so this used to be an asylum where they used to send people to be admitted there. They would have a regular dose of wine there. They would relax. They would look at nature and so on and so forth. And hopefully, if they were neurotics, they would recover and come back into sanity. Can we have the next slide, please? Yeah, okay. So this is a box here on my right side wherein they were chained. They were very violent, very vigorous. So what do? No matter what chain you put them into, they would rebel and they would break it. So this is also used there. This is the picture of a mental asylum. I forgot to put where it is. It's probably in Europe or the US. Next, please. And this is the picture of Sigmund Freud, and this is his couch. Any client, especially women, when they came to him, he would tell them, lie down on this, relax, feel free, and he would talk to them. You were very free to, speak anything and everything that you wanted to. This is where the client slept. This is where Freud would sit and he would make his notes. He would not be in front of the client, and he would make all notes, and वहाँ से उसने build up किया, वहाँ से आया id, ego and super ego concept. ठीक है, next please. Okay, तो psychology, talk therapy से लेके medical model भी आ गया. लोगों ने बोला कि brain में damage है, तो lobectomy करना शुरू किया कि एक side से दूसरे side का लोब जो कनेक्टर है कॉपस कैलोसियम उसको काट देते हैं, तो मल्टीपल सर्जिकल प्रोसीजर्स करना शुरू किया. ठीक है, ऐसा भी देखा कि एक आदमी जो यूएस के रेल रोड में काम कर रहा था, सडनली एक डायनामाइट ट्रैक बनाने के लिए, ठीक है, डायनामाइट रखते थे, तो डायनामाइट उड़ गया और एक जो स्पीयर था वो उड़ के ऑर्बिट से लेके एक ब्रेन में चला गया. और उसके बाद उन्होंने देखा कि उसका पूरा बिहेवियर ही चेंज हो गया. तो डॉक्टर्स ने उसको ऑब्जर्व किया और बोला कि वो स्पीयर ब्रेन के किस एरिया को पियर्स कर रहा है और क्या बिहेवियरल चेंज है. वहाँ से मेडिकल मॉडल आना शुरू हो गया और वहाँ से उन्होंने इलेक्ट्रोकन्वल्सिव थेरेपी भी स्टार्ट किया. आज भी इलेक्ट्रोकन्वल्सिव थेरेपी, स्किज़ोफ्रेनिया, जो लोग बाइपोलर में हाइपोमेनिया और मेनियक डिप्रेसिव डिसऑर्डर हाई स्टेज मेनिया में जाते हैं, उनको इलेक्ट्रोकन्वल्सिव थेरेपी देते हैं. इलेक्ट्रोकन्वल्सिव थेरेपी सेफ है. ऐसा नहीं है आप जो इसे पिक्चर में देखते कि शॉक दे दिया. उसके लिए प्रोसीजर होता है और पेन फ्री है. ठीक है, मेडिसिन इज ग्रोन टू बी पेन फ्री. तो ये सब ऐसे पिक्चर्स हैं. एंड द ड्रग, आपको एक किताब पढ़नी चाहिए जिसका नाम है द ड्रग दैट चेंज्ड अमेरिका. बहुत सारे मेडिसिन आ चुके हैं, इनका एक लिस्ट है, अगर वहाँ तक पहुँचा तो आपको बता दूंगा. लेकिन एक ड्रग है जो मुझे सबसे प्यारा है. दैट्स अ मेडिकेशन व्हिच आई लाइक. And there's a book, it's a very beautiful book called The Drug That Changed America. It's called Prozac. Have you heard of a drug called fluoxetine? Fluoxetine is a specific serotonin reuptake inhibitor. And the minute, not that the other drugs are less important, but fluoxetine changed the way people in America looked at mental health. Everybody who was depressed, everybody who had the Monday morning blues, everybody who had a psychological illness, everybody who was low and down and so on and so forth, he would take a drug called Prozac. Prozac today in India is called, it came in India as fluoxetine. And that is my wonder drug. Of course, it has got a lot of variants like there are many SSRIs. Fluoxetine, I forget, I'll tell you. Bharat, fluoxetine. What are the other SSRIs? Acetalopram. Okay, anyway, we'll come. If I remember that, I'll tell you. But this is the drug that changed America. Okay? And even today, it's very, very beautiful. Okay, we'll go to the next slide. Okay? Yeah, what is the history of psychiatry in India, or psychology, or mental health in India? You don't even have to mention about it. Okay? If you go to the next slide, you will see that we take our recourse from history, from philosophy, from religion, from spirituality. The next slide, please. Okay? We look at the Bhagavad Gita. किसी को कोई तकलीफ है आपका सब उत्तर भगवद गीता में मिल जाएगा. You don't need any other book apart from the Gita. Do you need any other book apart from the Bhagavad Gita? Yes? चाहिए? Yes, sir. Do you need a book? You need Enid Blyton. You need Tom Sawyer. You need Mark Twain. You don't need the Bhagavad Gita right now. Okay? Good. He needs Enid Blyton. I need the Bhagavad Gita. तो जो भी चाहिए वो सब भगवद गीता में है, वेद में है, पुराण में है, शास्त्र में है. ये सब क्या है? अलग अलग तरीके हैं लोगों को बोलने के लिए कि चिंता मत करो, ऐसे तकलीफ हर किसी के ज़िंदगी में आते हैं, आप सुधर सकते हैं. कोई बड़ा नहीं है, कोई छोटा नहीं है, हर किसी को ये स्टेज से गुजरना पड़ता है और ये हमें शक्ति देता है. These are books. Keep them as books. Respect them. Revere them. Right? Your head is more important. If your head is there, you can understand the Bhagavad Gita. Somebody said, I have gone through the Bhagavad Gita 10 times. I said, wonderful. Has it gone through your head once? I don't know. Okay? Swami Chinmayananda's Bhagavad Gita is the best. Radha Krishna's Bhagavad Gita is terrible. Okay? So, no, I'm not yet done. So then, go back please, go back. Then you have the Panchatantra. The kid needs Panchatantra, wherein, in those stories, who are good friends, who are bad friends, and so on and so forth, morals are given there. These are all ways of strengthening. They're giving you solace during your weak times. Yoga mein bolte hain, yoga for relaxation, and so on and so forth. Charaka Samhita is a beautiful book. All the Ayurvedic texts. The minute you talk about Ayurveda, he will say this kashaya, that abhanga, this and that, and everybody will talk about, making the mind cool, relaxed, and calm. So from philosophy to medicine, it is also available in Indian philosophy. The sad part is we don't understand Sanskrit. Our parents never made an effort to teach us Sanskrit. Okay? So, we're at the verge of losing it. Okay? Yeah, we'll go to the next one, please. Okay? Next, yeah. So what are the different schools of psychotherapy? Okay? What do you mean by psychotherapy? Schools of psychotherapy. When you do work post my basic degree in medicine, if I do a specialization in psychiatry, okay, or if I do a specialization in mental health, I become a psychiatrist. Okay? But if I'm not a medical doctor, okay, and I want to study mental health, and there are different schools, which I want to learn and use it with people. I don't call them patients, I call them clients. I want to use the principles and techniques in that school of thought to treat my clients. Then I'm following a school of psychotherapy. Therapy is treatment, psyche is the mind. Do you know where the mind was? Where is the mind? Yeah? Mind ka genesis kahan par hai? Nobody knows. Okay? For the Greek, the mind was in the brain because he used to think from the brain. For the Indian, my mind is here. But you ask the Egyptian, astronomy came from Egypt. What would he do? Astronomy was discovered by those slaves who built the sphinx and the pyramids. They used to make him work from morning to evening, night. They used to whip him. And to get rid of the pain, he used to drink. He used to drink and he used to lie down on the sand dunes like this. And that's when he saw the Taurus, he saw the Leo, he saw the Pisces, and so on and so forth. सवेरे नहीं दिखता है. रात को जब दारू जाता था सब astronomy दिखता है. He said mind is in the stomach. Are you understanding that? ठीक है? You ask an Egyptian, he'll say my mind is here. You ask an Indian, he'll say my mind is here. You ask the Greek, he'll say my mind is here. Where is the mind? Mind is an abstract concept. So mental health was an abstract concept. It's still abstract, and we're trying to make it as concrete as possible. Let's see the pluses and the minuses of that. So when we go into the schools of psychotherapy, each of them, believe me, each of them is a beautiful journey on its own. And it's not a one-day, two-day program. It takes years. Next, please. Hey, bhai. I command your undivided attention, more faithful than my wife. Please. Okay? So we have the first one who is the pillar of psychotherapy is Sigmund Freud from 1856 to 1939. He founded what is called as the psychoanalytic psychotherapy. Then you have analytical psychotherapy, existential therapy, behavioral therapy, cognitive psychotherapy. You have today a mixture of cognitive and behavioral, which is very, very prominent and very useful. It's called cognitive behavioral therapy. Then you have the Jungian person-centered therapy. Each of them will have a 5-year, 6-year, 7-year, 8-year training program. It's not a 1-day, 2-day, 3-year program. I'm a US licensed board-certified clinical psychotherapist. It took me 8 years. Okay, my license has lapsed because I don't have money to pay them their fees. That's a different issue. We learn the money afterwards. Okay. Then there's what is called as transaction analysis. I'm a trainer in TA. It took me 9 years to do that. Okay. We follow, the parent, the child, the parent adults as a child model, and it's wonderful. You understand one tool. You use the techniques of that tool to analyze, first understand your client, to find out what his behavioral problems are, and then use the tools in this school to resolve those issues so that the person goes back into being a very normal individual. You have TA, I've learned TA, you have Gestalt by Fritz Perls, you have psychodrama by Moreno, you have group therapy, you have Adlerian therapy, you have sex therapy. Oh, wonderful. If you're literally looking at sex therapy, then you should look at William Masters and Virginia Johnson. They were the pioneers of sexual therapy. Okay? Masters and Johnson book on male. Even today, probably 45 years after sex therapy came into being, Masters, I stole that book from library. Please don't record this. A very expensive book. Okay, it's a big book. William Masters and Virginia Johnson. You want to understand a team, you should understand the relation between William Masters and Virginia Johnson. William Masters was a gynecologist and Virginia Johnson was a steno. But the amount of contribution that Virginia Johnson did to the works of William Masters is amazing. There's a book, I forget the exact title, a report on male sexuality. It's called as Masters and Johnson. The minute you say Masters and Johnson on the internet, you'll get that. The second one is a book by Sheer Height. The third one is a book by Eric Berne, which is called as Sex and Human Loving. A combination of these three forms the basis of what is sexual therapy today. There's big money today. Okay, I also have a diploma in psychosexual medicine. Much to the annoyment of my wife, I went and paid $1.5 lakh. I passed the exam though. Okay, the fee was expensive. I'm hoping to earn some money out of it. Anybody having erectile dysfunction, premature ejaculation, my number is available there, so I can help you out with that. That's a different issue. Okay, so primal therapy, marital or couple therapy, okay, family therapy, child psychotherapy, neuro-linguistic programming also was about 5-7 years back, the pop culture, but it's very, very wonderful. I've also learned that neuro-linguistic programming is a co-creation of Richard Bandler and John Grinder. It combines clinical hypnosis of Milton Erickson. It looks at Virginia Johnson's family therapy, and linguistics of Noam Chomsky. No, linguistics of somebody else. So neuro-linguistic programming is a very, very wonderful and a beautiful science. If you know this, you'll be able to look at signs, symptoms, and help your client reach a very productive, comfortable, normal life. Hypnotherapy is Anton Mesmer. Okay, feminist psychotherapy, I don't know much about it. Encounter groups, yes, there were encounter groups being used. And if at all you really want to read one book, then I want you to read a book called Logotherapy, Man's Search for Meaning, which looks at existentialism, which is written by Viktor Frankl. The story of Frankl is very, very, very beautiful. It brought tears into my eye. Viktor Frankl एक जू था. उसको नाज़ी कंसंट्रेशन कैंप में बंद कर दिया था और जब लोगों को चुना गया था कि डेथ रो में गैस चैम्बर में जाने के लिए, विक्टर फ्रैंकल बोलता है कि मैं ये उम्मीद रख के जी रहा था कि मैं आज जिंदा रहूँगा, और वो उम्मीद ने बचा के रख दिया, क्योंकि तुम जाओ तुम जाओ तुम जाओ, विक्टर फ्रैंकल, उसके दिल में ये उम्मीद था कि नहीं मैं आज जिंदा रहूँगा, तो उस उम्मीद ने उसको बचाया, क्योंकि हाथ यहाँ से तुम जाओ इसको छोड़ दिया. हर रोज़ वो बोलता था ऐसे. तो उम्मीद बहुत ज़रूरी है. Okay? And then he made notes. तो नाज़ी ने पकड़ लिया, नोट्स फाड़ दिया, जितने बार भी लिखा था उतने फाड़ दिया, चारकोल लेके प्रिजन वॉल में लिखा, मिटा दिया, जेल से वापस आया, फिर किताब लिखा, फिर पब्लिश हुआ, और एक किताब अगर आप जिंदगी में पढ़ेंगे, यू विल फील वेरी वेरी हैप्पी, दैट्स मैन सर्च फॉर मीनिंग। बहुत सारे किताब है, ओके, सो दैट्स लोगोथेरेपी। बहुत सारे और स्कूल है, मुझे जो मिला था मैंने बता दिया, ओके। तो लेट्स लुक एट कॉन्सेप्ट्स इन इसके पहले okay, next, okay, let's go to concepts in psychiatry, okay, yeah, next, yeah. So why do people go for psychotherapy or they go to a psychiatrist? Okay, it's very simple. I told you, no matter what I write on the slide, understand one thing. You can read this, understand one thing. Today, if I stand here on stage and start removing my clothes, what will you do? What will you do? I've just removed my coat. So I'm going to remove my t-shirt, I'm going to remove my pant, I'm going to remove my half pant, whatever is there inside, I'm going to remove that. What are you going to do? Huh? 1 minute, what will you do? Nothing. Believe me, you will not do anything. You will just shut your mouth, you will sit. If there's anything worthwhile to watch, you'll watch. If there's nothing worthwhile to watch, you'll go out, have a cup of tea, have your lunch, and that's about it. Am I clear on that? किसी का हिम्मत नहीं है, किसी का मजाल भी नहीं है कि मुझे कुछ करे या कुछ बोले। बोलेंगे वहां बैठ के, क्योंकि रीढ़ की हड्डी नहीं है, वो अलग बात है। ठीक है, कुछ नहीं करेंगे। But the minute I remove all my clothes and I come and touch anybody here, like Pankaj or like Pawan, still nobody else will do anything. But the minute I touch money from Pawan's money is important to Kothari. Okay? And that's when Kothari will put his foot down and say, throw Prabhu out. And that's the state of, son, I mean, I'm not looking at you. You were there, so I picked you up. I'm sorry about that. Okay? I mean, I don't have money, but my money is also yours. Okay? So that's the state of mental health. That if you see me in distress, you will not help. If I start troubling somebody, even then you will not help. Okay? But if I'm troubling somebody and that trouble affects you, only then you will be taking him to a mental health consultant. And all this is the compulsion to repeat the same thing, the unbearable feeling of being stuck, a general dissatisfaction with life, a crisis, being haunted by the past, depression, anxiety, phobias or fears, relational difficulties, problems with peers, superiors, subordinate, work relations, simple interest, can't grow. I want to be a therapist. Oh, okay. A lot of people who want to be a therapist, हर कोई बोलता मैं काउंसलर हूँ, तीसरे घर में हर कोई काउंसलर बन जाता है। ये कोई पॉलिटिशियन या म्युनिसिपैलिटी का काउंसलर नहीं है, ठीक है? इसके लिए मेहनत करना पड़ता है, and every therapist who wants to be a therapist has to undergo therapy by himself or herself. Without undergoing self-therapy, you can never be a therapist. There's a need for that. Some other specific reasons for seeking therapy. Next, okay. So, the 3 major purposes of classifying. कितना time हो गया भाई, पंडित जी? हो गया? Okay, next. Mardo. 3 things I want you to understand. The first one is cognition, affect, and conation. Your cognition is your thought. Your conation is your action. Your affect is your feeling. The minute there is an incongruency in any of these 3, that's when you will see you require help. And I'll finish this and stop it done. I have 50 slides. Okay. Now please understand one thing. Any disturbance in these 3, okay, that can be considered as an illness. Okay. But if you look at the second one, a clinically significant psychological or behavioral syndrome that causes significant distress, disability, or loss of freedom, which is not merely social. Okay? Which is not merely a socially deviant behavior or an unexpected response to a stressful life event. I can come here, sit and cry in front of you. I can exhibit a varied amount of emotions. I can express anything. But the minute I recover, that means I don't have mental illness. I have coping difficulties. Okay? Fine. Next. Yeah, okay? So you have the medical model, you have the utopian model, subjective, social, there are different models. Okay? Now please understand that mental health is not one pinpoint. It's a spectrum between the normal and the disorder. We need to be somewhere in between. Okay? Have you heard a statement that anger runs in his family. Have you heard this statement? गुजरात है ना? एक गुजराती में एक स्टेटमेंट है, मैं बोल दूं? बोल दूं? हाँ? आप लात मार के तो नहीं निकालेंगे, लेकिन सुना है मैंने बहुत बार. हाँ? कोई जानता है what I want to say? It's a very derogatory statement, given to women. गुजुबे लोग बोलते हैं. You know that? What's it? No, can you send him out, please? I don't want him to learn that. It's a very derogatory statement which men speak about women. What's that? Huh? Itna guzro ave china. They say bairo tu sutela sara. Yes? Yes, no. Now that's a statement which goes on in a male-dominated Gujarati family. And you will see, he would have heard his grandfather, his father, his forefathers saying that blah, 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 blah. And today, what is the status of the women there? The woman that gets into that family, this clan, this clan, this clan, and this clan, is used to the fact because she has heard her father or grandfather say that. And she will develop her behavior to be ba, 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 ba. Is that dysfunctional? No. The dysfunction starts when you rebel. When you put your foot down against that and say, no, this is not right. And that's the reason why you need education. Next, please. Okay, the two books that you should read. The first one, if you really need to classify psychiatry, you need to look at the ICD. When I read it, was ICD-10, the International Classification of Disease, which is the UK model, and the DSM, the Diagnostics and Statistics Manual. When I read it, was the DSM-4 TM. Now they have the DSM-5. That's the American model. I beautifully like the DSM model because he gives you hair split in that. Uska access itna beautifully describe karta hai कि DSM-5 से प्यार हो गया. If I had to marry again, I would marry her again. Anyway, next. Okay. So some types of patients that you will see in your clinical practice. Next, please. Histrionic will be very dramatic and emotional. Dependent, there's a great need for your attention. Demanding, they will catch you and sit on your neck. Narcissistic, they will as though very superior to you. Next. Suspicious patients, anything you will do, they'll suspect your motive. Isolated, they'll come that I'm an isolated guy. I prefer sitting very silently and quiet. I'm very isolated. Obsessive, they're orderly, punctual. I'm a very obsessive guy too. You touch my pin, I'm going to break your neck. Okay? So obsessive patients, one. Okay? Next, sir. Help detecting complainers, you give them any help, they will throw the help out. Manipulative patients, they know you will not even know that they're being manipulative of you. Next, please. Okay, next, sir. Okay, I just want to give you terminologies because each of this is tremendously, terribly big. I want to finish off in some time. How much time will you give me? How much time will you give me more? If you want to give. Do you want to give me time? Yes, no? I can't hear you. How much? 1 hour? No. 1 minute? Good. Thank you very much. Psychiatry is very beautiful. Enjoy. I'll just run you through the topic for the person who said 1 minute. Next, please. Okay. Delirium is confusion. Next. Dementia is a chronic brain disease where the cells of the brain deteriorate. Substance abuse, all of you know, you've seen me smoke. And probably if Pawanji takes me out, I'm going to have a good drink tonight because I've done with my seminar. Okay, next. Oh no, uske piche. Third one is schizophrenia. Schizophrenia is a wonderful disease. And there was a drug. Electroconvulsive therapy was designed to treat schizophrenia. There are different categorizations of skids. Okay, basically it means split personality, but there's a lot more to it than just a split personality. And one beautiful drug for schizophrenics is a drug called risperidone. It's from a herb called Rauwolfia serpentina, and along with trihexyphenidyl hydrochloride, it works wonders. This is a drug that has changed the lives of many schizophrenics all over the world. Next, please. Okay, there are aggressive, there are passive, there are catatonia, there is hebephrenia, बहुत सारे classification. इसको आप पढ़ते जाएंगे, आपको प्यार हो जाएगा mental health से. Next, sir, mood disorder जो हम सबको आता है, maniac जब हम mood ऊपर की तरफ होता है तो हम euphoria अच्छा लगता है, elation See, there's a difference. Euphoria is a mild elevation of mood, elation is a moderate elevation of mood, exhalation is a severe elevation of mood, ecstasy is very severe elevation of mood. हम लोग बोलते हैं I went to this meditation workshop, I was in ecstasy. अब DSM-4 निकाल के देखेंगे तो बोलेगा यार इसको तो maniac depressive disorder दवाई मार के भगा दो. Anyway, next please. Depressive is depressed, depressive ideation, where you have hopelessness, helplessness, worthlessness. See, all these are normal emotions. When you get stuck in these emotions and you're unable to get out of it, that's when you're classified as disease. Okay? Suicidal tendency. Then you have bipolar. Bipolar, that means two poles vacillating between low and high. Either here or either there. That's bipolar. Okay? Earlier it used to be called as MPD or maniac personality disorder, but then they said it's not a personality disorder, it's a mood disorder, so they call it as a bipolar disorder. There are different types of splits in this. Next, please. Then, yeah, okay. Then you have persistent mood disorder, mixed anxiety, masked depression. You never know. People sitting here will be masked. They have agitated depression, neurotic depression. These are all different types of categorization of the psychiatric illness. I want to bring you to one term. The next slide, please. Next slide. Neurotic stress-related somatoform disorder. Okay. There are two terms I want you to remember. One of them is psychosis, the second one is neurotic. All of us are neurotics. We don't have any chemical locha in the brain. Okay? Many times we are socially dysfunctional. Psychotics are people who have the so-called, there's a definition for that. There is a definition for clear-cut psychosis and clear-cut neurosis. We are all diagnosed or undiagnosed neurotics. Okay? Those who are diagnosed are taking medication. Psychotics are very well in the hospital. Okay? Yeah, next. 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 Obsessive compulsive, next. Next. Oh, irritable bowel syndrome is also classified as a psychiatric condition. Also, psychiatric conditions are called as functional diseases. Next. Premenstrual syndrome, there is a psychological component involved. Next. PTSD, I was in the Bangalore airport yesterday morning, and suddenly this guy, I was very tired, I hadn't slept for 2 days. Suddenly this guy comes up to me and said, sir, he saw my t-shirt. He asked me whether I had served in the Jammu and Kashmir, and he said, sir, I think you have PTSD. Okay? I just smiled at him and walked away. Anyway, next. Then you have a mental disorder due to a general medical condition. I won't get into this. Next, please. Next. Next. Anything and everything can cause a psychiatric condition. Next. 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 Okay. I want you to take a snap of this because this is the timeline of the medications that came in psychiatry. Next slide, please. Okay. The first one is Ayurveda, where sympathy and kindness. Then bromide, chloral hydrate. Freud used cocaine. Okay. Barbiturates were used. Okay. And Julius von Wagner, malarial treatment. Chloroquine was used to treat the insane. Can you understand? Chloroquine was used to treat the insane and he got a Nobel Prize for that? जो मलेरिया का दवाई है वो insanity के लिए हम लोग यूज करते थे. For example, do you know a drug called sildenafil citrate or tadalafil citrate? Next slide, please. Pandit ji, हो गया? Okay. इसलिए पंडित जी. Do you know a drug called sildenafil citrate? Do you know a drug called sildenafil citrate? Do you know the story of that? Sildenafil citrate was first marketed by Pfizer to be a cardiac output drug. Heart का दवाई था. Okay? Heart का output बढ़ाने के लिए उन लोगों ने research किया और उन्होंने उसको वापस मार्केट में भेज दिया. और जब लोग इस्तेमाल करते थे तो उनको पता चला कि बहुत लोग हार्ट अटैक से मरते थे. And the simple reason was they started having erections, they began to perform, they had atherosclerotic plaques, and while performing they had heart attacks and they passed away. So when they started doing research, they said, oh look, it's more beneficial to market this as a drug for impotency than as a market for heart disease. Heart disease तो 50, 60, 70 के ऊपर उम्र में आता है, लेकिन इरेक्शन का प्रॉब्लम 20-25 साल में भी आ सकता है. तो उन्होंने वो ड्रग को वापस निकाला और उसको वाया आगरा करके वायाग्रा बना दिया. So हर चीज़ का एक स्टोरी होता है, हिस्ट्री होता है, पढ़ाई कीजिए. Thank you very much for the extended time. I'd like to stop now.
Thank you so much, Prabhu sir, for this wonderful session.
थैंक यू. मिस होमो, मुझे बहुत भूख लगी है.
अरे मिस हेट्रो, तुम्हें क्या? हम सबको बहुत भूख लगी है, तो चलो एक छोटा सा ब्रेक ले लेते हैं और लंच कर लेते हैं. पर तुम